Hey everyone, Dr. Jason Denise here. I hope you're staying safe. Want to talk about a topic this morning that is very hard to talk about, end of life. Now, the first thing we learn in medical school is, of course, one certain outcome from all of our lives is death. And often this is such a hard topic to talk about with loved ones, people that you care for. But it's so important. And no matter how difficult it is, I think it's something that we should all discuss with either parents who are elderly or siblings, spouses who have multiple medical conditions. If you're a power of attorney, you have health for somebody, you need to talk about this. You need to get over the stigma attached with it and just talk to the person about it. To start a discussion, I just want to bring to your attention, there are documents, and the one in Ontario we do use. If you go to Google or whatever your search engine is and type in "Do Not Resuscitate Confirmation Form, Ontario," so "Do Not Resuscitate Confirmation Form, Ontario," it will print off of a form for you. You can print it off. There's no serial number, so it's not an official document until you talk about it with your doctor or your healthcare provider and actually get one with a serial number on it. But this is a good starting point for your discussion with your loved one. Now, on there, I just want to talk about when you print that form off, there's a number of things on there that it lists what you want to do. We use that form mainly if you have one from your doctor that has a serial number on it. You can put that on your fridge, so if a paramedic is called to your house for an emergency, they can look at that form and know right away what your wishes are. So that's important. On there, you're going to be asked certain questions. What do you want us to do? And the big thing about this is we're not trying to, we want to work with you. We want to make decisions with you that are in your best interest. So we'll ask you, do you want things like chest compressions? So if they find you without breathing, you're non-responsive, do you want chest compressions? The reason that's important is a lot of times that's not futile. It won't bring you back to life. And it can cause rib fractures. It can cause disfiguration to the body because they have to really push deep in order to get the heart beating. The other thing they do is sometimes put a tube down your throat where they artificially breathe for you. And that's important because that can cause irritation to the throat, of course. And also, a lot of times, if you're on a ventilator, then we have to ask the hard questions to your family and loved ones. When do we stop? And the third thing is when they shock you. So bringing your heart back into a normal rhythm. A lot of times too, that does not work if you have multiple medical conditions, if you're elderly. It doesn't bring you back to a good quality of life. So it's very important that you have a realistic discussion with your loved ones about that. And it's important, if your doctor hasn't talked to you already, that you bring that form to your doctor and say, hey, look, this is we've talked about this. We want to get your thoughts, your input on it, and we want an official form so we can keep that at home. Now, when you come to the hospital, we're going to ask you all the same questions again. We have to. And it doesn't mean that we expect anything bad to happen, of course. But I have to talk to you about that. And if you say to me, hey, you know what, I don't want intubation. I don't want my heart compressed, compressions to happen. It doesn't mean your care is going to be any less. You're still going to get the same exact care and quality of care. Antibiotics, IV fluid if you choose to do so. But we just won't do those things that you don't want us to do to you. And when you are in an emergency, we can't ask you those questions, so that's why we have to ask you ahead of time. The other thing I think we have to talk about too is realistic expectations at end of life if we have family members who are very sick. Perhaps they're in a long-term care facility. And the reason why this is so important to talk about with your loved ones and to make sure everybody in your care team is aware of it is it's not always great to transfer your loved one to hospital. You have to ask yourself, what are our goals of care at this point? So let's say you have a parent, a loved one who has multiple medical issues. Maybe they have some dementia. You transfer that person to hospital. You're taking them out of their home environment. You're moving them in an ambulance into an emergency room. Then, if they do get admitted, they're moved to a floor. We're likely doing lots of blood work on that person, perhaps putting a catheter into their bladder. They're going to be surrounded by strangers. And the thing is that a lot of times this can tip the person over into delirium where they become more confused, they become more agitated. And then we have to give them medications for the agitation, which can cause side effects. Often individuals who are in this state will pull out their IV or pull out their catheter. They're just not happy. And so that's the reason why it's so important that we talk about, do you want us to transfer your loved one? What are your goals? Do you want us to do major surgery on this individual? Is that what you want? Do you want us to run multiple tests on this person? Is there a realistic outcome if we do run multiple tests that we'll be able to fix the underlying issue? Do you want us to have them hooked up to IVs, hooked up to monitors, hooked up to a catheter? Is that what that person wants? Is that what you want as their family member or power of attorney? Because often that can lead to complications. And sometimes it's more important just to keep that person in their long-term care facility or at home and use our excellent home care resources to help that person out, so we know that we're just treating their pain. We know that we can give them oxygen at home. If they're having shortness of breath, there's a lot of medications we can give them. Nursing team can show you how to give injectable medications, or they can administer those for you. We can get you a hospital bed at home. And especially now with the restrictions on visitations, they can be surrounded by their loved ones. And is that a better outcome for that person? And often the case it is. To stay at home, stay where they're familiar, stay where they want to be. And that way we're treating that person with respect and we're following their wishes. So very important to talk about this. Talk about it, talk to your healthcare provider about it, and even though it's a hard decision, it's a hard discussion, make sure you do that so we are all acting together in the best interest of the individual, the best interest of the people you love. Okay, hard discussion, but make sure you do it, okay? Stay safe, everybody.